Welcome back, everyone, to Season 2, Episode 17, a question and answer session of Workers Comp Unwrapped. I'm Max, and I'm joined today by Aisha, who have a whopping 15 years of experience in the workers' comp industry.
Wow, whopping. That makes me feel old.
Well, you're a wealth of knowledge. Today, we're tackling some common questions our audience has asked about workers' comp fraud.
Absolutely. It's a big issue, and it's costing everyone billions each year. Providers, insurers, and even injured workers themselves.
Right, so let's just jump right into our first listener question. What are the biggest red flags that a workers' comp claim might be fraudulent? Just little hints that something might be off.
That's a great question, and it's one we get asked a lot. I'd say one of the biggest red flags is when you see inconsistent injury reports.
So when a patient changes their story about how they got hurt.
Yeah, exactly. If the story keeps changing, that's definitely a warning sign that something's up. Like, imagine a worker claims a back injury from lifting a box, but then waits 2 weeks to report it.
Oh yeah, that's suspicious.
And then, to make it even worse, nobody actually saw it happen.
Yeah, big red flag.
Definitely a big red flag.
What about those cases where someone reports an injury first thing Monday morning, but they say it happened over the weekend when no one was around?
Oh, the classic Monday morning injury. We see those all the time. It doesn't automatically mean fraud, but it definitely makes you wonder. Especially if, the workplace is usually pretty busy during the week. A lack of witnesses, that can be a little suspicious.
Makes sense. So inconsistent stories, delayed reporting, no witnesses.
Yeah.
Are we seeing a theme here? What else should providers be watching out for?
Well, another thing to keep in mind is that sometimes the symptoms a patient describes just don't quite match up with what you're seeing in the medical findings.
Like when someone claims they're in excruciating pain, but their exam and tests don't show any real injury.
Exactly. It's a disconnect that raises a red flag. And finally, we often see patients who have what we call excessive medical complaints. They may constantly escalate their symptoms or demand more and more treatment without any clear medical justification.
So they're kind of overdoing it with the complaints.
Gotcha. Yeah, that's one way to put it. It's about looking for those patterns and inconsistencies. But remember, these are just potential warning signs, not proof of fraud.
Okay, that's a really important distinction. It's like those cases where someone tries to insure their sports car as a minivan to get lower premiums. Definitely shady, but not necessarily proof of fraud.
That's a good analogy.
Speaking of shady, this next question comes up a lot from medical providers. What's the best way to handle a patient you suspect might be exaggerating or even faking an injury? I imagine that's a really delicate situation.
It really is. You want to provide the best care, but you also have this nagging suspicion that something's just not quite right.
So what do? Do you confront the patient directly?
No, it's much more nuanced than that. As a medical provider, your focus needs to be on the objective medical evidence. You're kind of like an impartial investigator, just gathering the facts. So focus on conducting a really thorough clinical exam. Use assessments, range of motion tests, imaging, functional assessments. Really build up a solid foundation of objective data.
So documentation is like a doctor's superpower in these cases.
You got it. Document any inconsistencies you see. If their pain level doesn't match up with what you're observing during the exam, or their functionality seems better than they're letting on, note it.
Just state the facts, no judgment.
Exactly. And think about additional evaluations like a functional capacity evaluation or an independent medical exam.
Those can be really helpful, can't they?
Absolutely, especially in those cases where you have those lingering doubts. It's about getting a clearer picture.
And it's important to remember the doctor's job isn't to determine if someone's committing fraud.
Right.
That's up to the investigators. Okay, good to know. Now, this next question is one I'm sure keeps a lot of providers up at night. Can a medical provider be held liable if they unknowingly treat a fraudulent workers' comp claim? Scary thought.
I understand the concern, and the short answer is yes, but. There's a big but. Liability usually only comes into play if there's evidence of negligence or intentional wrongdoing.
So if a doctor is following all the protocols, documenting everything, and staying ethical, they're generally protected.
Exactly. You can't be expected to be a mind reader.
That's reassuring. But what about providers who are actually part of the fraud? What if they're overbilling, falsifying records, or working with shady characters?
Well, that's a totally different story. Those are serious offenses, and we're talking about serious consequences, fines, audits, even criminal charges.
So the takeaway here is follow the rules, document meticulously, and base everything on objective medical evidence.
You said it.
All right, let's tackle a question that I know touches on a very real fear: retaliation. How can a provider report suspected fraud without putting themselves at risk?
Yeah, it's a valid concern. Thankfully, there are systems in place to protect whistleblowers. Most states have these anonymous fraud reporting hotlines.
Anonymous, so no one knows who reported it.
Right, no tracing it back to you, so you can provide information without fear.
Can you give us some examples of those hotlines?
Sure. In California, there's the Department of Insurance Fraud Division. Texas has the Division of Workers' Compensation Fraud Unit. And in Florida, it's the Division of Investigative and Forensic Services.
And what about nationwide?
For that, there's the National Insurance Crime Bureau, the NICB Fraud Hotline.
Okay, so there are options. What about reporting internally, like for providers who work in a hospital or large group?
Yeah, absolutely. You can often report through a compliance officer or some kind of designated fraud reporting channel.
And just to be clear, retaliation for reporting fraud, that's illegal, right?
Not illegal. You're protected.
Good to know. So let's talk a bit about employer fraud. What are some common ways employers try to game the system, and how can providers spot it?
One of the most common things we see is misclassifying employees.
Misclassifying. What does that mean?
Well, it's when employers deliberately list high-risk workers, like construction workers or manufacturing workers, as if they're lower-risk clerical or administrative staff. They do this to avoid paying higher premiums.
Trying to save a few bucks, but putting workers at risk in the process.
Exactly. It's just not right. And another tactic we see is employers pressuring doctors to downplay injuries or clear employees for work before they're truly ready.
Oh, wow. Putting the provider in a really tough spot.
Yeah, they're trying to influence the provider's medical judgment to reduce the claim cost.
So what's a provider supposed to do if they're facing that kind of pressure?
Stand your ground. Document everything. Refuse to compromise your medical judgment. And remember, your medical license and your credibility are on the line. You need to protect those.
It takes courage to stand up like that.
It does, but it's so important.
Okay, last question before we move on. What should a provider do if they suspect another provider is committing billing fraud? That seems like a pretty big accusation.
It is a big deal, and not all billing discrepancies are intentional fraud. Mistakes happen, and sometimes it might just be a matter of sorting things out with the billing department.
So don't jump to conclusions right away.
Exactly. Now, if you do notice a pattern of concerning billing practices, things like excessive billing for unnecessary treatments or billing for services that never even happened, then there are steps you can take.
Like what?
Well, first, check with your own billing department, just to rule out any simple errors.
What if they don't have an answer?
Then you should carefully look at the patient's medical records, make sure that the treatments being billed for actually make sense medically.
Okay, so double check everything.
Right. And if you work in a bigger practice or hospital, talk to your compliance officer. They're trained to handle these situations.
And if, after all that, you still think there's fraud,
then it might be time to report it to the authorities, like the state medical board, a fraud division, or even the insurance carrier.
so there are options, but it's a serious matter.
Very serious. Fraudulent billing can lead to fines, license revocation, the whole 9 yards.
It's just not worth it. All right, well, that was a lot of great information about fraud, Aisha. But let's switch gears a bit now and talk about those virtual hearings that are becoming more common these days in workers' comp cases. What advice do you have for providers who are navigating this new world?
It's a great question because virtual hearings definitely have their own unique challenges, compared to being there in person.
Yeah, it's got to be harder to connect with people through a screen.
Exactly. So it's even more important to be prepared and come across professionally.
So what are some practical tips for providers to make their testimony really count during a virtual hearing?
First off, treat it just like an in-person hearing. Dress professionally, find a quiet, well-lit spot, and make sure your technology is all set.
So like giving a presentation.
Exactly. Engaging your audience, even if it's just through a screen.
And since things can feel a bit impersonal online, what else can providers do to make sure their message gets across?
Be concise. Stick to the facts, don't ramble, and use clear language that everyone can understand.
Keep it simple.
Yep. And for those technical glitches that always seem to happen, test everything beforehand.
Oh yeah, the dreaded tech problems.
Make sure you've got a good internet connection, close any unnecessary apps, and have a backup plan just in case your internet goes down.
Always good to be prepared. So be prepared, be professional, and be concise.
You got it.
All right, let's take a quick break and come back to tackle some more questions. Stay tuned.
Sounds good. Welcome back. We're diving back into those burning questions about workers' comp fraud.
We've got another great one lined up. Isha, this one comes from a listener who asks, what should I do if an employer pressures me to release a patient back to work before I think they're medically ready?
Ooh, that's a tough one. It's like a classic scenario, unfortunately. You know, you're caught between the employer who wants their employee back on the job, but you also have your obligation to the patient. You have to put their health first. It's a tough spot.
It really is.
Yes.
So what's the best course of action for a provider who's in this position?
Well, first and foremost, remember, you're the doctor. The final decision about when a patient is ready to go back to work rests with you. You can't be forced to release someone before you believe they're medically fit. Your responsibility is to your patient, not to the employer's bottom line.
Right. It can be easy to feel pressured, though, right? Especially when you're dealing with a pushy employer.
Absolutely. So if an employer is giving you a hard time, the first thing you should do is just talk to them. Have an open and honest conversation. Explain your concerns, tell them why you think the patient needs more time, and just reiterate that you're committed to doing what's best for the patient based on the evidence.
Communication is key.
It really is. A lot of times, just explaining things calmly and professionally can diffuse the situation. But if the employer just keeps pushing, trying to force you to release the patient, even though you know it's not right, well, then you have to stand your ground.
Stand firm on those medical ethics.
Exactly. And to protect yourself, document everything. Write down the date, the time, what the employer asked for, how you responded, just in case there are any legal issues later on.
So it's like creating a paper trail to protect yourself.
Exactly. And if you ever feel like the pressure is crossing a line, like it's becoming intimidation, take it seriously. Report it to your supervisor or your compliance officer. And if it doesn't get better, you might want to consider talking to a lawyer. You have a right to practice medicine without feeling threatened or pressured.
That's really important for providers to remember. You have rights, and it's okay to stand up for yourself and your patients. Okay, let's move on to something we touched on earlier, billing fraud. One of our listeners wrote in with this question. I've heard stories of providers overbilling for services or even billing for things that never happened. How big of a problem is this, and what's being done about it?
It's true. Billing fraud is a real problem, and it can happen in a lot of different ways. Some providers might inflate the number of treatments, bill for more complicated procedures than they actually did, or even bill for services that never happened.
It's shocking that anyone would take advantage of patients like that.
It's definitely not right. It's hard to say exactly how widespread it is, but it's a big enough problem that people are taking it seriously. Insurance companies and regulatory bodies are always trying to catch this kind of stuff. They're using data analysis to look for suspicious billing patterns, and they're doing audits to make sure everything's accurate.
So they're cracking down.
Oh, yeah. And there are serious consequences if they catch you doing something wrong. Fines, penalties, even criminal charges. It's just not worth the risk.
Not at all. And what about whistleblowers? People who see something wrong and report it. Are they protected?
Absolutely. There are laws to protect whistleblowers. In fact, there's even a law called the False Claims Act, and it actually lets people sue companies that are defrauding the government, including those involved in workers' comp fraud. And if their case is successful, they can actually get a portion of any money that's recovered.
So there's an incentive to speak up.
Yeah, but it's more than just that. Reporting this kind of stuff isn't about getting someone in trouble. It's about doing the right thing. It's about protecting the system and making sure resources are used to actually help injured workers,
That makes sense. It's about the bigger picture.
Right.
Okay, now let's talk about virtual hearings.
Yep.
With everything that's changed because of the pandemic, they've become a big part of the workers' comp process. So how has that shift impacted things? And what can providers do to be effective in this new format?
Well, the biggest difference is just the lack of physical presence, right? In a regular hearing, you're in the same room with everyone, the judge, the lawyers, the other parties involved. But in a virtual hearing, everyone's in their own little box on the screen. It can feel very detached, and it makes it harder to really connect with people and get your expertise across effectively.
Yeah, it's like something's missing.
Exactly. So it's even more important to be prepared and to present yourself professionally.
So what are some practical tips for providers?
First off, treat a virtual hearing just like you would an in-person hearing. Dress appropriately, choose a quiet and well-lit spot, and make sure your technology is working properly. It's all about making a good impression, even if it's just through a screen.
So like giving a presentation.
Exactly. Engage your audience, even if it's just through a screen. And since virtual hearings can sometimes feel impersonal, it's really important to be concise and focused in your answers. Stick to the facts, don't ramble, and use clear language that everyone can understand.
So be clear, be concise, and get to the point.
Got it. Now, what about technical issues? Any advice for minimizing those risks during a virtual hearing?
Definitely test everything beforehand. Make sure you've got a stable internet connection, close any unnecessary applications on your computer to free up bandwidth, and have a backup plan just in case your internet goes down. You want to be prepared for anything.
Always good to be prepared.
Exactly.
Now, let's dive into a question that can be tricky for providers. How can I, as a provider, differentiate between legitimate pain and suffering and potential malingering or exaggeration in a workers' compensation case? It sounds like a delicate situation.
It is a really important question, and you need to approach this carefully and objectively. You know, it's not always black and white. It can be really hard to tell if someone's pain is genuine or if they might be exaggerating things.
So how do you navigate that?
Well, first, don't jump to conclusions or start accusing anyone. Your job is to evaluate their symptoms, do a thorough exam, and order the right tests. You're gathering information to figure out what's going on. So be thorough and objective.
Right. Now, there are some signs that might make you think twice. Things like if the patient's symptoms don't match what you're seeing, if they have a history of a lot of work-related injuries, if they've been seeing a bunch of different doctors for the same problem, or if they're not getting better even though they're getting the right treatment.
So look for patterns and things that just don't add up.
Exactly. And if you have concerns, write them down in the patient's medical record. But be careful about the language you use. Don't be accusatory or make assumptions about their motives. Just stick to the facts, describe what you see, and the things that don't seem to add up.
Let the evidence speak for itself.
Exactly. And if you really think someone's malingering, you can refer them for a psychological evaluation or an independent medical exam. Sometimes you need a specialist to really figure out what's going on.
A fresh perspective can be helpful. Okay, let's talk about those states where workers' comp fraud is a really big problem. How does that affect providers? And what can they do to protect themselves?
That's a great question. In those high fraud states, providers are under a lot of scrutiny. From the insurance companies, the regulators, even law enforcement. They're more likely to get audited, investigated, and even sued. It's a tough environment to work in, and even small mistakes can have big consequences.
That sounds stressful.
It can be, so you really need to be on top of your game.
So what are some strategies providers can use in those situations?
The most important thing is to be proactive about compliance. Have clear policies and procedures for everything, train your staff well, and do regular audits to make sure everyone's following the rules. It's about creating a culture of compliance from the start.
Don't wait for problems to happen, prevent them.
Exactly. And in those high fraud states, you need to be extra careful when you're screening new patients. Make sure their claims are legit, talk to the employer to confirm the details, and look for any red flags like inconsistencies in the patient's story or a history of suspicious claims.
So do your homework.
Right. And if you do suspect fraud, you need to know how to report it the right way. Most states have special fraud units or hotlines where you can report your concerns anonymously.
So knowledge is power.
It absolutely is. The more you know about workers' comp and how to spot fraud, the better off you'll be. It'll protect you, your practice, and your patients.
Let's do a quick recap of those key takeaways for providers in those high fraud states.
Okay, so first, compliance is everything. Make sure you have those strong policies and procedures, train your staff, and do those regular audits. Second, be really careful when you're screening new patients. Make sure their claims are legitimate. And finally, if you suspect fraud, report it. Do it promptly and confidentially to the right authorities.
Great advice, Aisha. It's a lot to think about, but at least providers aren't alone in this, right? There are resources and support systems to help them navigate it all.
Definitely. Don't be afraid to reach out for help if you need it.
All right, Aisha, we've covered a ton of ground today, and I think our listeners have gotten some really valuable information.
I hope so.
Before we move on, any last words of wisdom for our listeners?
Just keep learning. The more you know, the better you can protect yourself and your practice.
That's good advice for life in general.
It really is.
All right, Aisha, this has been fantastic. Thank you so much for being here and sharing your expertise.
My pleasure. Thanks for having me.
And to all our listeners out there, thanks for tuning in. If you have more questions about workers' comp fraud or anything else you'd like us to cover, send them our way. We love to hear from you. Now let's get into those virtual hearings and how they've changed the workers' comp landscape. Aisha, tell us, what's the biggest difference providers need to be aware of between in-person hearings and these virtual ones?
Well, the most obvious difference is that you're not physically there in the same room. In a traditional hearing, you'd be sitting in front of the judge, the lawyers, all the other parties. But with virtual hearings, everyone's participating remotely. It can feel really impersonal, almost like you're just talking to a screen.
It's like that old saying, something gets lost in translation, right? Except in this case, it's not just the words. It's the whole human connection that can be harder to establish.
Exactly. That's why it's even more important to be prepared and make sure you come across professionally.
So what are some practical tips for our listeners to make their testimony really shine in a virtual hearing?
First, treat a virtual hearing just as seriously as you would an in-person hearing. Dress professionally, choose a quiet, well-lit spot for your video conference, and for goodness sake, make sure your technology is working.
It's like giving a presentation, right?
Yeah.
You want to make sure you engage your audience, even if it's just through a screen.
You got it. And because virtual hearings can feel a bit impersonal, it's extra important to be concise and focused in your answers. Stick to the facts, avoid rambling, and use clear language that everyone can understand. You're there to provide expert medical testimony, not to give a lecture.
So be clear, be concise, and get to the point.
Got it. Now let's talk about those technical glitches that seem to plague every virtual meeting these days. Any advice for minimizing those risks during a virtual hearing?
Definitely test everything beforehand. Make sure you have a stable internet connection, close any unnecessary applications on your computer to free up bandwidth, and have a backup plan just in case your primary internet connection fails. You want to be prepared for anything.
That's great advice. It's all about being prepared for the unexpected. Now, actually, let's shift gears a bit and talk about a question that can be a bit sensitive. How can I, as a provider, tell the difference between legitimate pain and suffering and potential malingering or exaggeration in a workers' compensation case?
That's a really important question, and it's one that we need to approach with a lot of sensitivity and a commitment to being objective. It's not always easy to tell the difference between real pain and someone who might be exaggerating or faking it.
It sounds like a real balancing act. What are some things providers should keep in mind when they're trying to make this distinction? First and foremost, don't jump to conclusions. Don't start accusing the patient of anything. Your role is to evaluate their symptoms, conduct a thorough physical exam, and order any necessary tests to figure out what's causing their pain. You're gathering information to get a clear picture of what's going on.
So it's all about being thorough and objective in your assessment.
Exactly. Now, there are some things that might raise a red flag. For example, if what the patient's telling you doesn't match up with what you're seeing during the exam, if they have a history of multiple work-related injuries, if they've been seeing a lot of different doctors for the same problem, or if they're not getting better even with appropriate treatment.
So you're looking for patterns and inconsistencies that don't quite add up.
Precisely. And if you do have concerns, document them carefully in the patient's medical record. But here's the key. Avoid using accusatory language or making definitive statements about the patient's motivations. Just stick to the facts, describe what you observe, and any inconsistencies you notice.
So let the evidence speak for itself.
Right. And if you're really concerned that a patient might be malingering, you can consider referring them for a psychological evaluation or an independent medical exam, or IME, conducted by a specialist who's trained to evaluate these kinds of cases.
Okay, that makes sense. Sometimes you need a fresh set of eyes and some specialized expertise to really get to the bottom of things.
Now, let's shift our focus to those states where workers' comp fraud is a particularly big problem. A listener asked, what are some of the unique challenges that providers face in these high fraud states? And what strategies can they adopt to protect themselves and their practices?
That's an important question. In states where workers' comp fraud is rampant, providers face a lot of scrutiny from insurance carriers, regulators, and even law enforcement. They might be subject to more frequent audits, investigations, and legal challenges. It's a high-stakes environment, and even small errors can lead to big problems.
It sounds like a pressure cooker.
It can be, so it's essential to be extra cautious and proactive.
What are some strategies providers can use to navigate this challenging landscape? Well, one of the most important things is to be proactive about compliance. Implement robust compliance programs within your practice. This means developing clear policies and procedures for documentation, billing, coding, and patient interactions. You need to build a culture of compliance from the ground up.
So don't wait for problems to arise. Prevent them from happening in the first place.
Exactly. Providers in high fraud states should also be very careful about screening new patients and verifying the details of their workers' comp claims. This might mean contacting the employer to confirm the injury and looking for red flags like inconsistencies in the patient's story or a history of suspicious claims.
So it's almost like providers need to become detectives in a way.
In some cases, yes. And if a provider does suspect fraud, they need to know how to report those suspicions appropriately. Most states have designated fraud units or hotlines where individuals can report their concerns confidentially.
So it sounds like knowledge is power in these situations.
It really is. The more you know about workers' comp and the potential for fraud, the better equipped you'll be to protect yourself, your practice, and your patients.
All right, let's quickly recap those key takeaways for providers in high fraud states.
Absolutely. So first and foremost, prioritize compliance. Make sure you have those strong policies and procedures in place, train your staff thoroughly, and conduct regular audits to stay ahead of the game. Second, be extremely diligent when screening new patients. Verify their claims and make sure everything checks out. And lastly, if you suspect fraud, report it. Do it quickly, confidentially, and to the appropriate authorities.
Great advice, Aisha. It's a lot for providers to manage, but thankfully they're not alone in this. There are resources and support systems out there to help them navigate these complex challenges.
Absolutely. Never hesitate to reach out for help if you need it.
Okay, Aisha, before we wrap up, any final words of wisdom for our listeners?
My main takeaway is this: stay informed. The world of workers' comp is constantly evolving, and it's crucial to keep learning.
That's such great advice for life in general, right?
It really is. The more you know, the better prepared you'll be for anything that comes your way.
Aisha, it's been fantastic having you on the show today. Thanks for sharing your expertise with our listeners.
It's been my pleasure, Max. Thanks for having me.
And to all our listeners out there, thank you for tuning in to Workers Comp Unwrapped. We hope you found this Q&A session helpful and informative. Remember, knowledge is power. The more you know about workers' comp and the issues surrounding it, the better equipped you'll be to protect yourself and your patients. So stay informed, stay vigilant, and stay well. And if you have any more questions for us, don't hesitate to send them our way. We love hearing from you. Until next time, take care. Welcome back to Workers Comp Unwrapped. We're wrapping things up with our deep dive into your questions about workers' compensation fraud. We've got one more important question for Aisha, and this one's all about protecting yourself.
Absolutely. This is a big one.
Yeah, a listener writes in and asks, what can medical providers do to protect themselves from liability in workers' comp cases, especially if they're worried about fraud? I'm sure a lot of our listeners are thinking about that too.
It's a really common concern, and for good reason. But the good news is there are a lot of things providers can do to minimize their risks.
Okay, let's hear them. What's the most important thing?
Documentation. I can't stress this enough. Thorough, accurate documentation is the best way to protect yourself if you're ever accused of any wrongdoing, whether it's fraud or something else.
So basically cover your bases, make sure everything is crystal clear.
Exactly. Make sure your medical records clearly document everything: the patient's history, how they got hurt, what you found during the exam, the diagnosis, the treatment plan, the reason behind every decision you make.
So every detail matters.
Every single one. And be especially careful about documenting any communication you have with the employer, insurance adjusters, anyone involved in the case. You want a clear paper trail so anyone looking at the case later can understand exactly what happened and why you made the decisions you did.
So good documentation is like a shield for providers.
You got it. It can save you a lot of trouble down the road.
Okay, documentation, check. What else can providers do?
Well, you also need to stay up to date on the rules and regulations for workers' comp in your state. These rules can be complicated, and they change all the time. It's really important to stay informed.
Yeah, with all the changes, it can be tough to keep up. Any advice on how to do that?
There are actually a lot of great resources out there. Professional organizations, state medical boards, workers' comp agencies, they all offer educational materials, webinars, training programs. You just have to take advantage of them.
So there's really no excuse for not knowing the rules.
Nope. Information is power, especially in this field.
Okay, that makes sense. What about billing practices? We've talked about billing fraud, but even honest mistakes can cause problems, right?
Oh, absolutely. Billing errors, even if they're accidental, can raise red flags and trigger an investigation. So it's really important to have a good relationship with your billing staff and make sure they know the guidelines for workers' comp billing inside and out.
So good communication between the clinical and billing sides is key.
Exactly. You need to make sure everyone's on the same page and understands the procedures for coding, billing, documentation. You want a smooth process where everyone's working together and accuracy is the top priority.
Now let's go back to those situations where a provider suspects a patient might be exaggerating their symptoms or faking an injury. How can providers navigate those tricky situations and protect themselves?
Those cases are always tough. The key is to stay objective and focus on the medical evidence. If you have concerns, document them in the patient's chart, but be careful about the language you use. Don't accuse the patient of anything or try to guess their motives.
Don't play detective.
Exactly. Just stick to the facts, describe what you see. Note any inconsistencies between what the patient says and what your exam shows.
Let the evidence speak for itself.
Right. And if you're really worried, you can refer the patient for a psychological evaluation or an independent medical exam, an IME, done by a specialist who's trained in these kinds of cases.
So sometimes you need a second opinion.
Exactly.
Aisha, we've talked a lot about the potential risks and challenges for providers in workers' comp cases. But let's end on a more positive note.
Yeah.
What are some of the rewards that come with treating injured workers?
That's a great question. You know, workers' comp can be challenging, but it can also be incredibly rewarding. You have the opportunity to make a real difference in people's lives. You're not just treating their injuries, you're helping them navigate a complex system, get back on their feet, and return to their lives.
It's about more than just medicine. It's about helping people get through a tough time.
Exactly. And when you see a patient recover and go back to work, knowing you played a role in their recovery, well, that's an amazing feeling.
Absolutely. Those success stories make it all worthwhile.
I agree.
Well, actually, this has been a fantastic conversation. Thank you so much for sharing your expertise with us today.
It's been my pleasure.
And to all our listeners out there, thank you for joining us for this special Q&A session on workers' compensation fraud. We hope you found it valuable. Remember, knowledge is power. The more you know about workers' comp, the better you can protect yourself and your patients. So stay informed, stay vigilant, and stay well. If you have any more questions, please send them our way. We love hearing from you. Until next time.